Have you ever gone to pick up your insulin at the pharmacy and felt that sharp sting? Not from the injection, but from the price tag. If you're living on a fixed income, you know exactly what that moment feels like. You're standing at the counter, the pharmacist tells you the cost, and suddenly you're wondering whether you'll have to skip a dose or stretch your insulin just to make it through the month. For millions of seniors across the country, this isn't just a story, it's real life. But now, something important has changed, and if you have diabetes and use insulin, this change could save you hundreds, even thousands of dollars every single year. 000. Today, we're breaking down what the new insulin copay cap actually means for you as a Medicare beneficiary. Because there's a lot of confusion out there. Some people think it applies automatically, others don't know which types of insulin are covered, and many aren't sure how it connects with their Part D or Part B coverage. So let's clear the fog and make this simple. I'm your Medicare mentor, and if you or someone you love depends on insulin, what I'm about to explain could make a major difference in your health and your wallet. Let's start with the good news. Under recent Medicare changes, the cost of insulin is now capped at $35 per month per insulin product. That means no matter how many vials or pens you use, you can't be charged more than $35 each month for each covered insulin product. And that's whether you've met your deductible or not. Now that's a huge deal. For years, seniors have faced unpredictable insulin costs, sometimes $100, $200, even $300 a month depending on the brand, the pharmacy, and the phase of their coverage. Many were forced to ration their doses or switch to less effective insulins just to save money. Studies have shown that 1 in 4 Americans with diabetes has cut back on insulin because of cost. That's not just dangerous, it's deadly. So this $35 cap isn't just financial relief, it's literally life-saving. But here's the thing, not everyone knows how this benefit works. Some people still end up paying more simply because their plan details are confusing, or because they don't realize what's covered. So let's talk about how the $35 insulin cap fits into Medicare's structure and what you need to do, if anything, to make sure you're getting the savings you deserve. If you're on a Medicare Part D prescription drug plan, the $35 insulin copay cap applies directly to your plan's formulary. That means your plan can't charge you more than $35 for each covered insulin prescription per month. Even if you haven't met your deductible, you still only pay that capped amount. This includes insulin delivered through traditional vials or pens, and in some cases, even insulin used with certain pumps, as long as the insulin is covered under your Part D plan. If you're using an insulin pump that's covered under Medicare Part B, for example, through durable medical equipment, the same cap applies there too. You'll still pay no more than $35 a month for your insulin. Now, it's important to understand that this cap was introduced under the Inflation Reduction Act, which took effect in stages beginning in 2023. Initially, it applied to Part D plans and later expanded to include insulin under Part B as well. As of 2025, the $35 monthly cap is firmly in place across all Medicare-covered insulin products. Here's a critical point most people miss. Not every insulin is automatically covered just because it's insulin. Your plan still has to list that product on its formulary, the list of medications it covers. So while the cap limits the cost of covered insulins, if a particular brand isn't included in your plan's formulary, you might not get the cap for that brand. The best way to avoid surprises is to review your plan's drug list or call your plan directly to confirm which insulins qualify. Now, some people have noticed that their pharmacy still charges them more than $35 even after the cap was announced. If that's happened to you, don't panic. It's often a billing issue that can be corrected. Pharmacies and plans had a few hiccups implementing the change, but the Centers for Medicare and Medicaid Services required that any overcharges be refunded automatically. If you think you've been charged too much, you can call your plan, provide your receipt, and request a correction. Here's another piece of good news. This $35 cap isn't temporary. It's a permanent part of Medicare coverage going forward, and it applies year-round, no matter which phase of your drug coverage you're in. That means whether you're in the deductible phase, initial coverage, the coverage gap, or even catastrophic coverage, you'll never pay more than $35 a month per covered insulin. Think about that for a moment. In the past, some seniors paid less early in the year, but once they hit the coverage gap, sometimes called the donut hole, their insulin costs could suddenly double or triple. That unpredictable swing made budgeting nearly impossible. With this cap, those wild fluctuations are gone. You can finally count on a consistent, affordable cost every single month. Now, I know what some of you might be thinking. What about other diabetes supplies like needles, test strips, or glucose monitors? Unfortunately, those items aren't included in the insulin cap. They're still covered under your plan, but normal copays or deductibles may apply. However, Medicare has been expanding coverage for continuous glucose monitors and other diabetic equipment, so it's worth reviewing your options during open enrollment. Speaking of open enrollment, this is the time when it matters most. If you're watching this video during Medicare's annual enrollment period, which runs from October 15th through December 7th, you have the power to choose a plan that gives you the best insulin coverage at the lowest cost. Even with the $35 cap, some plans might cover more types of insulin or have better formularies that include the specific brand you use. Don't assume your current plan automatically gives you the best deal. Compare. Because sometimes a small change in your plan could mean big savings over the year. And if you're someone who doesn't take insulin but knows a friend or family member who does, share this information with them. Many seniors still don't know this change exists, and they're continuing to overpay because no one told them the rules have changed. Now, let's talk about how this change impacts your health. When insulin is affordable, people actually use it correctly. They take the right dose at the right time. They stop rationing. They stop skipping injections. That means better blood sugar control, fewer complications, fewer ER visits, and a better quality of life overall. Before this change, too many seniors faced heartbreaking choices. Skip insulin to buy groceries, or skip groceries to afford insulin. That's not how healthcare should work, especially for people who've worked hard their whole lives and paid into the system. This cap is a step toward fairness, giving you predictable, stable access to the medication you need to stay healthy. But let's go even deeper for a moment. What does $35 per month per insulin actually mean in practice? Let's say you use two types of insulin, one long-acting and one short-acting. You'll pay up to $35 for each type, so a total of up to $70 per month. If you're only using one insulin, you'll pay up to $35. That's it. And if you switch plans or your dosage changes, the cap still applies as long as the insulin remains covered. Here's another question people ask. Does this apply to people on Medicare Advantage plans? Yes, it does. Medicare Advantage plans that include drug coverage are required to follow the same $35 cap. So, no matter what kind of Medicare plan you have, you're protected. Now, you might hear people talking about other drug pricing reforms, like the $2,000 annual out-of-pocket cap that's coming soon for all Part D drugs. That's another major change coming in 2025. And when that goes into effect, it will make insulin and all your prescriptions even more affordable overall. But that's a topic we'll cover in another video here on Medicare Mentor. For now, the key takeaway is this. Insulin costs under Medicare are finally predictable and capped. You can plan your budget, protect your health, and stop worrying about shocking pharmacy bills. Before we wrap up, I want to leave you with something important. Medicare changes can be confusing. Every year, new rules, new plans, and new costs appear. But knowledge is power. And when you understand how these benefits work, you can make choices that truly support your health and your wallet. Yeah, that's what this channel is all about, helping you navigate Medicare confidently, without stress, without confusion, and without overpaying. If this video helped you understand the insulin copay cap, take a second right now to subscribe to Medicare Mentor. It's completely free, and every week we break down new updates, cost-saving strategies, and insider tips that make your Medicare benefits work harder for you. And if you know someone struggling with insulin costs, please share this video with them. You never know, it might just help them save money and protect their health. Thank you for watching, and remember, understanding your Medicare options isn't just about saving money, It's about taking control of your health and your future. I'm your Medicare mentor, and I'll see you in the next video.